Psychological Disorders, Part 8. One must keep in mind several factors and considerations before deciding the line of treatment. This can be best done by an expert in the field. So, the best thing is to seek out a professional and get the required help. It is rightly said, having a mental disorder isn't easy. It is even harder to accept. Yes, I am ill. The hardest of all is when people assume you just can't get over it. The fact is, you cannot automatically just get over it. You need to work towards the right path to be able to get over it. Healing is not automatic, it is a journey that needs to be trodden. Summary. Psychological disorder is a condition that involves experience of distress and impairment that affects his/her emotion, behavior, thought, and levels of functioning. Psychological condition of disorder is dynamic and ever-changing. Psychological health and illness are not two distinct categories but instead lie on a continuum. The major criteria for mental disorder are clinical syndrome, distress, impairment, and dysfunction, but expectable responses to stressors and behavior conflicting with social, cultural, or political system are not signs of psychological disorder. Dimension of mental wellness is different from dimension of illness. Mental wellness is concerned with certain positive emotional and psychological aspects and with well-defined life philosophy. DSM and ICD are two major classification systems to classify psychological disorders. There are various psychological disorders including anxiety disorders, depressive disorders, bipolar disorders, substance-related and addictive disorders, schizophrenic disorders, and many more. There are many signals that can indicate onset or presence of psychological disorders which can be helpful to identify them at an early stage. There are different therapies for the treatment of mental disorders that are available. Only mental health professionals are qualified to make decisions regarding which treatment plan to follow. Important concepts are mental wellness, distress, dysfunction, syndrome, DSM-5, ICD, Alcoholic Anonymous, hallucination and delusion. Important psychologists are John Travis. He is an American author and medical practitioner who introduced the concept of wellness and originated the illness-wellness continuum. Paul Eugene Bleuler. He was a Swiss psychiatrist who coined the term schizophrenia in 1910, derived from the Greek words schizion, which means split, and phren, which means mind. First aid in mental health. Learning objectives. To sensitize students to mental health issues. Second, to make them aware of the signs and symptoms of various mental illnesses. Third, to acquaint them with various first aid techniques for mental health issues. Fourth, to increase their awareness about the importance of mental health professional. Introduction. Activity 1. Activity 1. Make a list of the activities you perform to take care of your physical health. Now make a list of the activities you perform to take care of your mental health. Discuss the two lists in your class. How many things could you list? Did you find making one list easier than the other? Introduction. If you find making the second list harder, do not worry, you are not alone. We are usually aware of what we need to do to take care of our physical health, but we are unsure of how to take care of our mental health. As children, our parents always tell us what we need to do in order to lead a healthy life. Usually, this advice is about the behaviors we should adopt in order to stay healthy. For instance, before exams, they might tell you to eat food that has been cooked at home. get adequate sleep, etc. This is done to make sure that you do not fall sick during the exams. These are some of the preventive measures that are taken to protect the body's immune system, which might already be compromised due to the stress of the examination. We all agree that our physical health is important. Do you think our mental health is any less important? How much care do we take of our mental well being? Look at the box given below. Box number 1, Mental Health Statistics in India. According to a study conducted by National Institute of Mental Health and Neurosciences (NIMHANS) from 2014 to 2016, 10% of the population suffers from common mental disorders, 1.9% suffers from severe mental disorders, and 13.7% of the Indian population will at least once in their lifetime be diagnosed with a mental disorder. It is important to remember that even if one isn't diagnosed with a mental disorder, stressors of daily life such as pressures at work or studies, overcrowding, lack of social support can all contribute to poor mental health. Do you know? Mental Health First Aid (MHFA) is an internationally recognized training program designed to teach people how to identify the signs and symptoms of mental health and provide assistance on a first aid basis. The MHFA course was originally developed by Betty Kitchener, a registered nurse specializing in mental health education, and Anthony Jom, a professor of psychology in Australia.